Hello, my name is Juliet Blakeslee-Carter. I am a resident at the University of Alabama at Birmingham, and I'm excited to present the data from our prospective randomized pilot clinical trial comparing prophylactic versus therapeutic cerebrospinal fluid drainage during complex endovascular thoracoabdominal repair, in which a total of 20 patients were randomized to either receive a prophylactic drain prior to repair or a therapeutic drain after intervention in the event of spinal cord ischemia. This pilot trial was not powered to detect differences in clinical outcomes, but rather used to demonstrate the feasibility of enrollment and randomization and the implementation of a standardized spinal cord ischemia protocol across multiple enrollment sites.